We just learned about dementia, a part of mentation, and the age-friendly care approach. Mentation is a big word that mostly means mind or mental health. In this video, we're going to focus on work-related mentation because understanding and managing stress is essential to your health and well-being. You make a big difference in delivering age-friendly care, and you matter too. Stress is an automatic physical, mental, and emotional response to challenging events. It's a normal part of everyone's life. CNAs experience a variety of work-related stressors, and these stressors can often lead to burnout. Stress is a daily occurrence for most CNAs, who may encounter several emotional or physical demands on any shift. Stress can negatively affect our relationships with coworkers, our ability to make effective decisions, and our productivity at work. In nursing, stress can even have an impact on resident care. Sources of stress can include poor communication, poor teamwork, absent leadership, long shifts, and challenging coworkers or residents. In most situations, stress is not the result of a single trigger, but is a buildup of issues over time. Even if you love your career, stressful work situations can affect your health and can eventually lead to burnout. Managing stress can help you lead a more balanced, healthier life. Let's discuss a few stress management strategies. The first strategy is practicing self-care. It's not uncommon for people who are constantly concerned with the needs of others to wind up neglecting their own needs. At the same time, people who practice good self-care are usually less vulnerable to stress and fatigue than people who don't focus on self-care. Self-care routines look different for each person, but they should generally include a balanced, nutritious diet, regular exercise, routine schedule of restful sleep, balance between work and leisure, honoring emotional needs. Another stress management strategy is setting emotional boundaries. It can be especially important for healthcare workers to set firm emotional boundaries to protect their emotional well-being. Healthcare workers generally have a high level of empathy and compassion. The challenge for daily caregivers is to remain compassionate, empathetic, and supportive of others without becoming overly involved in taking on another's pain. Setting emotional boundaries helps maintain a connection with others while still remembering and honoring the fact that you are a separate person with your own needs. And remember, it's absolutely okay to ask for help if you're having a hard time managing stress. Think about reaching out to others who care about you and will support your well-being. You can talk to your supervisor, co-workers, friends, and family members. Engaging in outside hobbies can help you manage stress too. Maintaining a healthy work-life balance can help protect you from work-related fatigue and frustration. Spending a lot of time working and thinking about work and not enough time taking care of your personal needs can cause burnout. Studies have shown work-life balance is becoming more important to healthcare workers, and making time for leisure activities and personal hobbies outside of work can help lower stress levels and improve overall life satisfaction. Try to keep your healthy friendships outside of work. Even though it's great to have strong relationships with your coworkers, it's equally important to have healthy relationships outside of work. It can sometimes be difficult for coworkers to avoid talking about work, even outside of the workplace. Connecting with friends who are not aware of the ins and outs of your work situation can provide much-needed emotional and professional relief. You can also make a plan to reinforce your stress management goals. Sometimes it can be helpful to make an intentional plan to maintain your work-life balance. Keep a calendar or schedule of important life events and activities and refer to it when making work-related decisions. Set reminders on your calendar or phone to remind you to leave work on time to attend household responsibilities or outside activities. Create a set of rules that will help you know when to say no to extra work demands. For example, you might make a rule that you won't work late or take overtime if it will interfere with a scheduled personal activity or responsibility. Keeping a journal can help you manage stress. Journaling is an excellent way to process and express emotions that are related to work stress. Taking the time to monitor how you are feeling and connecting with your personal thoughts and feelings can help reduce a buildup of uncomfortable emotions, which can lead to hopelessness and burnout over time. Try to use positive coping strategies when you feel stressed. Sometimes it can be tempting to wash away your stress and emotional troubles in your job with alcohol or drugs. This can usually work in the reverse and increase stress in the long run. Consider making a list of positive coping strategies to use in times of stress. This might include deep breathing, meditation, taking a walk, talking with a friend, watching a funny movie, or relaxing in a hot bath. There are a number of workplace strategies that can help you manage or reduce stress. Workplace strategies can be an important part of reducing and avoiding burnout. If your employer does not currently have any in place, you can think about recommending strategies that have been proven to work, such as support groups and open discussions about work-related stress, taking advantage of regular breaks, routine check-ins, knowing and communicating your limits. For example, don't pick up additional days or avoid working overtime when you're feeling stressed. Acknowledge the stress that grief brings and participate in celebration of life ceremonies. Use PTO, paid time off, or sick leave to take a mental health day. Talk to a coworker about being a support buddy for each other during stressful moments. Take advantage of no-cost EAP, Employee Assistance Program, opportunities through your workplace. Set up relaxation rooms, massage, meditation classes, etc. And finally, if you're having trouble managing stress and it's affecting your sense of well-being, you can seek personal therapy. If you find yourself feeling emotionally vulnerable, significantly stressed, or overwhelmed, consider seeing a therapist who can help you process your feelings and start using skills or strategies to manage stress and fatigue to keep a healthy work-life balance. Your workplace might have a no-cost EAP, Employee Assistance Program, that can connect you with a therapist. Being proactive in addressing your needs is helpful and healing. Setting limits and boundaries can be essential to stress management. Make sure to work on your own life outside of your role as a CNA. For some people, keeping specific routines that separate their work from their personal time can be helpful. This can include doing things after work, such as taking a walk, riding a bike, or talking about non-work subjects. Remember our motto: what is good for the resident is also good for daily caregivers. Residents are unlikely to get high-quality care if the person caring for them, you, the daily caregiver, is stressed, burdened, and feeling frustrated throughout the day. It is important to understand what contributes to your experience of stress at work and to take steps to manage stress for the benefit of your own health and well-being.